Hi, I'm Jane, an Alto Pharmacist specializing in fertility. I'm here to walk through injecting your fertility medications. We'll go through several steps together, so stay tuned. Always make sure your hands are washed and you're working on a clean, flat surface. Let's begin. The box of Novarel, sometimes referred to as HCG, comes with a vial of powder containing 5,000 units of Novarel and a 10 milliliter vial of bacteriostatic water for mixing. For this injection, you will need at least one vial of 5,000 units of Novarel powder, depending on your dose, one vial of 10 milliliter bacteriostatic water, a 3 milliliter syringe, a 1.5-inch mixing needle, an injection needle, a few alcohol pads, a sharps container, and sterile gauze or tissue is optional. Before we get started, there are a couple of things I wanted to review with you. Examine your medication. Make sure the medication is not expired. Check to ensure there's no cracks on the vials and there's powder in the powdered vial. Make sure the bacteriostatic water is clear and does not contain any particles. If you see anything, call your provider or an Alto pharmacist for next steps. To begin, flip off the caps on the vial of Novarel powder and the vial of bacteriostatic water and wipe the tops with an alcohol pad. Unwrap your syringe and mixing needle and attach the needle to the syringe and pull off the needle cap. If your needle and syringe come already attached, you may skip this step. Pull back the plunger to draw air into the syringe. Fill the syringe with roughly the same amount of air as the amount of bacteriostatic water you were instructed to mix with. This is usually 1 milliliter or 1 cc. Place the vial of bacteriostatic water on a hard, flat surface and insert the needle straight through the center of the rubber stopper. Slowly press on the plunger to push the air in the syringe into the vial. This step will make it easier to draw up the solution because the vials are pressurized. Invert the vial and pull back the plunger to withdraw the amount of bacteriostatic water you were instructed to mix with. You will not need all of the solution in the vial. When you're done, flip the vial back and remove the syringe from the vial. Place the vial of Novarel powder on a hard, flat surface and insert the needle straight through the center of the rubber stopper. Slowly inject the solution into the vial of powder. Without removing the needle, gently swirl the vial until all of the powder is dissolved. Do not shake. Novarel powder usually dissolves fairly easily. Without removing the needle, invert the vial and slowly pull back the plunger to withdraw the entire contents of the vial into the syringe. The amount of liquid inside the vial is fairly little, so you'll have to slowly pull the needle out of the vial as you withdraw the solution to ensure the tip of the needle is submerged in the solution. Once you've withdrawn all of the liquid, remove the syringe from the vial. Depending on your dose, your provider may instruct you to mix another vial of Novarel powder with this solution. Otherwise, recap the needle, twist it off, and discard it into the sharps container. Now, attach the injection needle to the syringe and pull off the cap. To remove any air bubbles, tap on the side of the syringe so the bubbles move to the top. Gently push on a plunger until you see a tiny droplet come out of the tip of the needle. Once you see the droplet, you are ready for your intramuscular injection. Today, I'll show you how to inject into the upper outer quadrant of the buttocks muscle, since it's the most common location for an intramuscular injection. But always check with your provider or nurse before injecting to ensure you're injecting at the prescribed location. Because an intramuscular injection can be uncomfortable, you can ice the area for a few minutes with an ice pack, prior to injection to numb the area. You should also alternate your injection sites to decrease discomfort. To prepare for your injection, clean the injection site with an alcohol pad and allow the area to air dry. Hold the syringe in your dominant hand with your thumb and fingers like you would hold a dart. Firmly stretch the skin at your injection site with your thumb and index finger on your non-dominant hand. Insert the entire length of the needle into the stretched skin at a 90-degree angle with one swift motion. Stabilize the syringe with your free hand and pull back slightly on the plunger. If you see blood return, do not inject the medication and withdraw the needle. Repeat your medication preparation process and inject at an alternate site. If there's no blood, the needle is inserted properly and you can inject the medication slowly. Push on the plunger in a slow and steady motion until all of the medication is injected. Quickly withdraw the needle when you are done. Lastly, apply pressure to the injection site with a gauze or tissue. Discard the used needle and syringe in the sharps container. Gently massaging the injection site afterwards can help to reduce discomfort and spread the medication. You can also apply a bandage if needed. There may be minor bleeding, bruising, and redness around the injection site. All of this is common and should not be of any concern. Let's talk about storage. Before mixing, Novarel can be stored at room temperature until the expiration date. Once the powder has been mixed, it must be stored in the refrigerator and expires within 30 days of mixing. You're done. Thank you so much for watching. If you have any questions, visit alto.com to get in touch with an Alto pharmacist.